You know, even though March is Colon Cancer Awareness Month, any time during the year is a good time to get a colonoscopy, get scoped. I talked here recently, not long ago, with back in March, with Dr. McNeese. Let him know that it's been 13 years since I've had one. He said, no, it's time, especially at my age. So I did it. Came into Singing River Health System, Ocean Springs office, and got my colonoscopy. And we're here today to talk about the importance of it. And actually, I'm going to share my results with you that I got, which were good results. And the fact that I did get screened at this particular time is very important. So
absolutely.
So let's talk about it.
Well, you underwent your colonoscopy and you did great. How was your prep?
My prep was good, and you know, a lot of people fear that. I know you do, because 13 years ago when I did it, I mean, it was really rough. But instead of starting it the afternoon before, excuse me, y'all started the 2 days before. I had my colonoscopy on a Friday, started the prep on a Wednesday evening with some milk and magnesia, and then the rest of it started Thursday, and it wasn't as bad. It wasn't as bad. It had that little precursor there going on, and then come rolling in here on Friday morning to get my colonoscopy. I was first on the list, so I was in here very early, but it was a great procedure.
Well, the prep's one of the most important things because it is direct. The quality of the prep is directly proportional to the quality of the scope. If you can't see, you can't diagnose. And as you can see from Jim's pictures, he had a really good prep.
I was good and cleaned out, huh?
That's right. That's right. We did find one polyp, and it was what we call a tubular adenoma, which is an adenomatous polyp. And those type of polyps are the ones that can go on to become colon cancer if left to their own devices. Not all of them will, but when we find a polyp, we take it out.
Right.
And that's why this is a preventative test. That's a picture of the little polyp, if you can see it. It's kind of on the edge, and there's another more frontal picture of the polyp. And that's removed. So when you have one polyp, which is an adenoma, you just need another one in 5 years. So maybe we can have another segment in 5 years to
see how we did with the follow-up. Yeah,
that is it.
So explain some of the other pictures here.
Well, so when you get to the end of the colon where the appendix connects, this is called the appendiceal orifice, and this documents that you had a complete colonoscopy. Also, for documentation and quality indicators, this is where the ileum, or the small bowel, comes into the colon. So it tells you that you got all the way to the end of the colon. Again, the polyp. And these are diverticuli, which are just outpouchings in the colon, which occur from increased colonic pressures, constipation, and where they pooch out is where a little feeding arteriole comes in through the muscular layer. So it's kind of like a little baby hernia.
Yeah.
But, you know, probably 60% of people your age have them. It's not uncommon.
Which is 64, by the way.
Well, maybe 64% then.
So go ahead. I'm sorry.
And this is a picture in the rectum where we retroflex the scope. So this is me looking back at the scope, and he's got some small internal hemorrhoids. But overall, a good colonoscopy, absolutely.
Good well,
yes.
I'm glad you talked me into doing it, and of course, I'm sure I'll see, like you said, see you again in 5 years.
That's it.
And see how we're doing that. But you know, a lot of people don't think about the fact that they could have one or two polyps that are precancerous, and left to their alone could
create a bad problem.
Exactly.
Definitely. And if you have, so in your case, they've had studies that show if you have a colonoscopy and have a polyp removed, you have a 53% less likely chance of developing colon cancer than the general population. So it's a hugely preventative test. And actually, over the last decade, the only cancer that's decreased in incidence has been colon cancer, and that's from increasing screening colonoscopies.
Okay, and I know that's something that, you know, working with Singing River Health System, that they really you know, you as a surgeon, and of course so many other surgeons that work with, they have specialize in these things, and you can find these things early. And again, I put it off. I can't, because the biggest fear was the prep. I hated the prep.
And that's 90% of people have heard about the prep, and you know they just don't want to do it.
Right.
But it's really not that bad as you
No, it was
experienced.
not that bad. It was not bad. I mean, yeah, it was uncomfortable. You can't get too far from a bathroom for a whole day. But I was pretty much by midnight that Thursday night, you know, I quit having to go all the time. And then, you know, by when I had to get up and get going for Friday morning to be at the hospital, at Ocean Springs Hospital, you know, I was good to go. And of course, you do have to have someone. My girlfriend, she picked me up in pouring rain. Bless you, Natalie, love you. But picked me up in the pouring rain, and you know, took me back, took me home, and then, you know, I was fine. You know, I was fine the rest of the day. Had 2 Egg McMuffins that morning, because you can't eat for a while. But I had 2 Egg McMuffins, sausage Egg McMuffins. But all in all, I mean, this is something, and it's something that, not only for men but also for women.
Absolutely, everybody has a colon. So
what is the best age? I mean, if you have a history of it in your family, is there a particular age you should start getting colonoscopies?
Typically, if you have a family history and a first-degree relative, 10 years prior to that diagnosis for that relative, or age 40. There are recommendations now for African Americans to have them at age 45. Our typical age of screening is age 50. And that's typically because that's what insurance will cover.
Right. It's a preventative type thing.
It is a preventative type
So
test,
insurance
just
will pay
like
for it.
your mammograms, your pap smears, your prostate exams.
Sure, sure. And again, you know, you're here with you know, regional digestive specialists in Ocean Springs, right, close to the Singing River Hospital, Ocean Springs Hospital. So if you need to make an appointment, do they need a referral? Need to get a referral from the regular
Not
doctor?
necessarily. They can call the office and we can get them in. They don't have to have a referral from their primary care doctor. You know, when you see your primary care doctor, talk to them about it. Ask them about a colonoscopy. So if you're over the age of 50, everybody needs one, and it's a quick, easy procedure that can prevent a whole lot of badness.
All right. Dr. McNeese, thank you so much.
Thank you, Jim.
Appreciate it. See you in 5 years.
Sounds good.
Again, you know, if you're due, it's time to get it done. Could save your life. Give them a call. Singing River Health System and Dr. McNeese.